I got a BBL and my butt's too big. I want to make it smaller. I'm starting to hear this more and more often, and I do think, unfortunately, it's going to be a trend the next 5 to 10 years. It's just, what society wants to see. If women want to have a little more fullness and fill out the, the hip dips. And, the reality is hip dips are actually normal. That's actually a normal thing for women who are a little bit leaner. It's just normal human anatomy, but this new society drive of having full round hips, that's not normal, anatomically. And so, BBLs or the Brazilian butt lift has been a really big hit in the past 10 years. I do quite a bit of them. But now I'm starting to see people come in that have had a BBL, gained weight, right? And then they're like, wow, my butt got big. Well, you put more fat in there. Of course it got bigger. So, they're always my proof. I want to tell people the fat transfer is a permanent thing. It will stay. It will last. Your butt will get bigger if you gain weight. Just telling you, this is how it works. So when you're unhappy with how big it is now and you want to maybe decrease your proportions, there's a couple options. The first option, probably the most straightforward option, is we basically do liposuction of the area, reduce some of the volume. Most likely is going to happen, you're going to have some skin laxity that will develop because you remove some of the volume. And so some aspect of skin tightening may and most likely be required. We have some great radio frequency technologies that will help tighten up the skin, such as Renuvion. That's one I'm using quite a bit now. And that will help tighten up the skin envelope, tighten down the soft tissue, and it gets it to contract and shrink down. Sometimes it's too much extra skin. You have a really true skin laxity and excess that's beyond the effectiveness of radio frequency technology, tissue shrinkage. And so the next kind of level is skin removal. So that incision line will maybe be on the top of the butt, might be on the bottom of the butt. And, every patient's a little bit different, but, I think this is going to be, a trend in the next 5 years. My prediction is to be, BBL reversals. So anyway, if you're interested and you want to learn more, don't forget, go see a board certified plastic surgeon. So if you found this information helpful, don't forget, like and subscribe. Hit the link on the subscription button below, and thanks for following.